Key workers have told the BBC they'll have to take time off work because of a lack of early years childcare. Over the last 2 weeks, nurseries have been closing across the UK, even to key workers. With small numbers attending, it's no longer financially viable to stay open. And in those that do, nursery staff are calling for extra protection when looking after children of NHS workers. Our education and family correspondent Frankie McCamley has more.
This was the last time these parents could drop their children off at the Little Jungle Nursery. Like many others across the country, it's now closed.
We've come to the realisation that we have to close because although we are getting the furlough, that's only going to cover 80% of salaries, and that's just salaries. So we have all the other costs that we're accumulating, so rent, business rates, and the revenue is not coming in.
The closure of nurseries has left key workers, including these frontline NHS staff, without childcare.
And this really left us quite stuck. It's difficult for two key worker parents, or indeed single parents, to continue working in even their current hours, let alone doing extra hours, if we don't have adequate childcare provision.
We currently do not have any childcare. My husband now has the option to take furlough, which would mean he'd be on 80% wages, but we're now in a position that in 3 months' time, my husband may not have a job.
In NHS, we are putting our lives at risk for the entire nation, and this is without any doubt our duty. Equally, it's a duty of the UK government to secure, without any delay, the funding for the designated schools and nurseries supporting key workers.
When parents are stuck in that position with no childcare like this to turn to, councils are trying to step in and find other places for them to go nearby. But this isn't a problem they faced in the past, so things could take some time.
New emergency legislation will give the UK government the power to force nurseries to stay open. If they do, there are calls for more guaranteed financial support and protection for staff.
I think they should protect them in terms of allowing them some flexibility of attendance. And I've also seen many nurseries saying, look, we're struggling to get protective apparel, whether it be rubber gloves, aprons, etc., etc.
That white bit there, I think we used it on here, didn't we?
Yeah. A group of medical students are trying to offer informal childcare where they can.
I don't possess all of the clinical skills necessary for me to help out in the hospital. But what I can do is look after the children of key workers. By filling in those gaps, we are able to enable the workforce to continue.
But this is only a short-term solution to what is a long-term crisis. If childcare provision isn't available, it'll only add to the burden of those already bearing the brunt. Frankie McCamley, BBC News.
Prince Charles is out of South